Hello everybody, my name is Abashya. I'm a third year Doctor of Public Health student and a diabetes self-management educator. Today's presentation is Type 2 Diabetes Self-Management, and we're going to be focusing on the South Asian American communities. Today's presentation is geared for community health workers and non-medical support professionals. Me personally, I'm passionate about type 2 diabetes because of history of type 2 diabetes that runs in my family. I have worked as a health educator in South Asia and here in US focusing on type 2 diabetes management. As we know, South Asian Americans have high prevalence rates of type 2 diabetes. Barsha is a community health worker in Edison, New Jersey, where there is a big South Asian American population. Before we move ahead with today's presentation, what we're going to do is we're going to do a quick knowledge check with a pre-test survey that Barsha is going to take right now. And at the end of the presentation today, me and Barsha are going to do a post-test. We're going to go over the answers together and make sure that we have the knowledge that's required. This is going to take Barsha a couple of minutes, and we'll move forward from this. Now that Barsha is done with her pre-test questionnaire, we're going to move ahead and talk about the main objectives of this session. There are two objectives. By the end of this session, we will be able to identify the three pillars of type 2 diabetes self-management, which are the role of healthy eating, physical activity, and glucose monitoring. And we will be able to describe the role of each of the pillars in managing type 2 diabetes. At any point, if you have any questions or concern, please feel free to pause me or interrupt me at any moment.
Sounds good.
Now let's talk about why self-management matters. Before we move forward, Barsha, what comes to your mind when we use the term type 2 diabetes?
High blood sugar level.
That's correct, but let me elaborate a little. Type 2 diabetes is a chronic and progressive condition, meaning it does not go away and tends to worsen if not managed properly. Unlike acute illnesses, chronic diseases require consistent long-term management. Everyday choices like what we eat, how active we are, and when we check our blood sugar have a cumulative impact on long-term health outcomes. These small daily habits may seem minor, but they play a big role in preventing complications like kidney damages, nerve pain, and vision problems. When you go out to the community and empower your patients with the right tools and support, we increase their confidence and ability to make decisions that reduce complications. Education and self-awareness are critical for helping patients take ownership of their health. This is important. Knowledge alone does not change behavior. Just knowing what to do isn't enough, but it's the essential first step. That's where self-management educators like me and community health workers like you come in. We bridge the gap between knowing and doing. When we talk about gaps between knowing and doing, can you talk about your experience as a community health worker when you interact with the members and patients in the community?
I do think that there are many members of the community, especially the senior members, who seem to have the knowledge, but they have a hard time applying that in their daily life because of their life, just daily life commitments, work, family commitments. I think they know what they need to do, but they're not able to really apply it.
Thanks for that feedback. That's a really good experience of yours that you shared, and that is the truth that the community is facing right now. That's why educating them, going to the community is so vital. Thank you. Before we move forward in depth on Pillar 1, healthy eating, I'm going to give you a quick question on healthy eating for type 2 diabetes. There are three options for the question. The question is, Which of the following is a healthy type 2 diabetes meal? A. Chicken with white rice. B. Grilled fish with quinoa and veggies. Or C. Sweetened cereal with milk.
Chicken with white rice?
Chicken is a very good source of protein, but white rice is a source of carbohydrates, but they tend to spike the blood sugar levels. And we'll go in detail as we move forward. Thank you. Now, when it comes to type 2 diabetes and healthy eating, we have probably seen this plate before. According to American Diabetes Association, this is what a healthy plate looks like for type 2 diabetes. As you can see over here, half of the plate should be non-starchy vegetables, and the other half should be divided between carbohydrate foods and protein foods. Like Barsha mentioned, white rice. White rice is simple carbohydrates. We want to avoid simple carbohydrates like white rice, white pasta. We want to substitute that with quinoa and sweet potatoes. And when it comes to source of protein, we want to stick to lean protein like fish, chicken, lean beef. But when it comes to South Asian cultures, we have to be very sensitive about how we present the nutrition guide, because some of the cultures restrict eating pork, beef for religious and other cultural reasons, so we have to be sensitive for that. And on top of that, it is not only what you eat, but the portion control and meal timing is equally important. So Barsha, what are some of the nutrition-related challenges that you observe when you go out in the community in Edison? What do you see?
The biggest thing that I have noticed when it comes to nutrition is that in a typical South Asian household, their daily meal is very heavy on white rice, potatoes, and roti, which is kind of a tortilla made out of flour, which is also another simple carbohydrate. So it's hard to create that balanced plate.
Thank you for that feedback. And now we know that it's important to educate them by making some simple changes in their diet, they can make tremendous positive changes to their health. Thank you for that feedback again. Another important thing, Barsha, it is very important to educate our community members on how to read the nutrition labels. Why don't you go ahead and pull up the nutrition label chart. So like we discussed earlier, it is very important when you go out to the community and interact with the patients, they have to know how to read the nutrition label. When they go out, buy their protein, carbohydrates, or it could be a simple orange juice like this. And this is considered to be very healthy in a lot of communities, not just South Asian communities. And this one has almost 40 grams of sugar. So this is like poison almost to someone with type 2 diabetes. I can't emphasize enough the importance of the members being aware of how to read the nutrition. So please make sure that you take this education material once you go to visit them and ensure that they are informed and know how to read the education material. So to recap on Pillar 1, healthy eating, we talked about what a healthy plate should look like, portion control, talking to a registered dietitian and getting a customized meal plan, and the importance of knowing how to read a nutrition label. Any questions, Barsha? All right, great. Now we're going to talk about pillar number 2, that's physical activity. Physical activity can help you prevent, delay, or manage type 2 diabetes. Physical activity isn't just going to the gym or engaging in intense exercise. It's any type of movement that increases your heart rate, blood flow, and muscle activity. Some of the other benefits include better sleep and mood, improved balance, lower blood pressure and cholesterol, lower risk of heart attack and stroke, lower stress level, managed energy, and stronger muscles. So Varsha, when you go out in the community, what are some of the barriers that the community members mentioned that's preventing them from being active?
I think a lot of the community members think that exercise is only done at the gym. So not having a membership at the gym, not being able to pay for a gym membership can be a big barrier for them. And I think another big barrier is time constraint, just having a busy schedule and not finding the time to exercise.
Yes, you bring up a great point. There is a huge misconception that physical activity can be done only at gym. But there are several other ways to get active around your house and your community. Even at your house, you can simply climb the stairs, or you can go out for a walk, you can garden, you can go out in the community center and get different type of activities like swimming, yoga, and a simple thing like a resistance band. One can invest in a resistance band and you can pretty much get a lot of physical activity done with a simple investment on a resistance band like this. So it's recommended that you're active at least 30 minutes a day, 5 days a week. And then you can break it to 15 minutes twice a day. Just by incorporating these simple activities on your day-to-day life can enhance the quality of your life drastically. So again, physical activity is the pillar number 2 for diabetes management. Now we're on pillar 3, blood glucose monitoring, which is one of the most essential habits for people living with type 2 diabetes. Monitoring your blood sugar helps you make real-time decisions about your food, activity, and medication. The American Diabetes Association, ADA, recommends the following blood sugar targets for non-pregnant adults. Before the meal, it should be between 80 and 130 milligram by deciliter. 1 to 2 hours after the meals, it should be less than 180 milligram by deciliter. And for A1C, which is your average blood sugar over the last 2 to 3 months, the target is below 7%. So why does it matter? Monitoring your blood glucose level helps track your blood sugar patterns over time. It allows for timely adjustments in your diet and medication, and most importantly, it helps prevent dangerous complications like hypoglycemia or other diabetes-related emergencies. So Barsha, I have shared with you the blood glucose log that's created by American Diabetes Association. Can you just go over what you see over there in the log?
It looks like it's a weekly log where we recommend our patients or clients to take their blood sugar levels before meal, after meal, after they take any insulin or medication, and at bedtime.
Yes, that is correct. And this is a great tool, and I highly recommend you take this with you when you go interact with the community members. This will help them tremendously to manage their blood glucose level. Again, pillar number 3 is monitoring your blood glucose level, which is one of the most essential habits to people living with type 2 diabetes. now that we've gone over the 3 pillars of type 2 diabetes self-management, I would like to go over a case scenario, Borsha. As you can see in front of your laptop, you have the scenario also, and you can take a couple of minutes to go over the scenario and look at the questions over there while I read it out. So Sunita is a 52-year-old patient struggling to maintain blood sugar. She eats white rice daily, doesn't test often, and avoids exercise due to knee pain. So the prompts for Borsha are: what 2 to 3 realistic self-management changes would Sunita make? And what barriers might she face? So Borsha, what are some of the realistic self-management changes that Sunita should make?
For the realistic self-management changes, I think for number 1, I have replace, since she's eating white rice daily, I would recommend her to replace the white rice with complex carbohydrate like quinoa or brown rice. And also she's not testing her blood glucose level often, so I would give her the blood glucose log that the American Diabetes Association has, so she can get in the habit of doing tests more often. And she is avoiding exercising due to her knee pain, so I would recommend her to go see a physical therapist who can help her come up with exercises that are knee pain friendly for her.
Those are going to be great recommendations. And how about number 2? What barriers might she be facing?
I think the biggest barrier is the fact that she has knee pain. It can be very limiting when it comes to what kind of exercises she can do, and I think just the fact that she has knee pain can also be the cause of lack of motivation.
Those are excellent points. Thank you for sharing that. Now that we're coming to the end of the presentation, before we end, Borsha, do you have any questions for me?
I do. I think the biggest challenge that I usually face is something we talked about earlier. That a lot of our community members, they know what to do, they know what's right and wrong, but they have a hard time implementing it. So, is there a strategy that you use to help them motivate?
That's a great question, and that's something that we all struggle with. I would start with empathy and connection. You got to start by setting up small, smart goals. For example, if your member is a soda drinker, you cannot go to the member and tell him or her to quit drinking soda immediately or completely. You have to have measurable goals like cut down soda by 3 days. And based on that, you should celebrate small wins and build momentum upon that. So that would be my biggest feedback, and to answer your question.
Yeah, thank you so much. I think that's really helpful, and the whole presentation has been very informative and engaging. Thank you.
And thank you, Borsha, for being part of this education session. I learned a lot from you, from your experiences as a community health worker, and I definitely have broadened my understanding of what it is to be interacting with the communities in New Jersey, Edison, New Jersey. Thank you very much. So here are some key takeaways from our presentation today. 1. Daily self-management prevents long-term complications. 2. Focus on small, sustainable lifestyle changes. And 3. Cultural sensitivity is the key, especially when you're dealing with various cultures in a melting pot in a city like Edison, New Jersey. Now, before we end, Borsha, we are going to go over the post-test together and go over the answers. So if you can pull up that questionnaire one more time, and we will end the session by completing the post-test.